And here is your question. Right. So if you've read and understood, considering it surgical anatomy station, kindly please tell me what exactly are you looking at?
Okay, ma'am. So this is a image of lateral view of neck.
Yes, which has been divided into
It
13 parts.
shows, different triangle.
Okay. So if I ask you to describe me how many triangles there are in the neck region.
Okay, so we have two major triangle, anterior and posterior triangle.
All right.
Then
Can
they
you
have some subdivision.
can you please tell me the boundaries of the anterior triangle?
Okay, so anterior triangle is on the midline. Midline is midline of the neck, and then posteriorly with the anterior border of the sternocleidomastoid, and superiorly is by the inferior border of the mandible.
How many triangles there are in the anterior
There
triangle?
are three subdivision of the triangle. Is a
Okay.
ventral triangle, carotid triangle, and muscular triangle.
And submandibular triangle as well.
Submandibular.
4. Okay. So
Okay.
would you be able to identify number 1 over here?
Okay, this is a posterior belly of digastric muscle.
Okay. What is number 13?
Is a submandibular triangle.
All right. Can you tell me the contents of submandibular triangle?
Is submandibular gland and middle marginal nerve.
And one muscle,
Uh,
hyoglossus muscle.
Hyoglossus muscle. Yes.
Okay. Can you identify number 12, please?
Anterior belly of digastric.
Good. 11.
Is submental triangle.
Please tell me the contents of submental triangle.
Is some lymph node and genioglossus muscle.
No. Omohyoid muscle, superior
Omohyoid
belly, and
muscle.
thyroid muscle, and hyoid bone. Okay. Right. Can you tell me the boundaries of the posterior triangle?
Okay, so anteriorly by the posterior border of sternocleidomastoid and posteriorly by the anterior border of trapezius muscle,
Yes.
and inferiorly by the middle 1/3 of the clavicle.
Clavicle,
And
right.
apex is by the union of sternocleidomastoid and trapezius at the occipital bone.
Please tell me the origin and insertion of trapezius muscle.
So trapezius is originated from the ligament of Naki, posterior knuckle line,
Yes.
and transverse process and spinous process of cervical 2 to thoracic 12 vertebra, thoracic 5th vertebra, and inserted into the posterior border of the clavicle and on the spine of the scapula.
Okay, thank you. What exactly are you looking at now?
So this is an anterior view of image of anterior view of neck.
All right. Can you identify the organ labeled A?
This is a superior thyroid artery.
Okay. Oh, sorry. Yes, I wanted to ask F.
The organ is thyroid
Gland. What are
gland.
the parts of the thyroid gland?
It has two lobes, right and left lobes connected with isthmus,
Yes.
and sometimes extra lobe is called pyramidal lobe.
Very good. Can you tell me the blood supply of the thyroid gland? both
So
arterial and
artery
venous.
supply is superior thyroid artery, which is a
Yes,
branch of external carotid artery,
yes,
and inferior thyroid artery, which is a branch of thyrocervical trunk. A
yes,
venous drainage is a superior and middle thyroid vein from the internal jugular vein,
yes,
and inferior thyroid vein is a branch of brachiocephalic vein. And sometimes 10% of cases, a thyroid innominate artery
yes, which
supplied the
supplies.
gland, which
All
is
right,
branch of brachiocephalic artery.
good, and supplies mostly isthmus. All right, can you please tell me superior thyroid artery, which structure is closely related to it?
Is superior laryngeal nerve.
Yes, and what happens then when that structure is injured?
So if he's injured, it has abnormality of the pitch. Patient cannot talk in high pitch sound.
Okay, all right. Can you, if you are looking at this view, can you tell me which landmark is used in case of emergency airway?
We can do a cricothyroidotomy
Yes.
in between the thyroid cartilage and cricoid cartilage.
Okay.
So we have to do a needle cricothyroidotomy in the cricothyroid membrane.
All right. Can you please tell me, right, what are the common carcinomas of the thyroid gland?
Is papillary thyroid cancer.
All right. Can you tell me what are the which nerves get injured when you're operating on the thyroid gland?
So is most common is recurrent laryngeal nerve, and
Yes,
sometimes can be external laryngeal nerve.
as well. All right, good. You're right. Moving on. Can you please tell me if you can identify this red structure?
Okay, so this one is not very clear, but it could be a external carotid artery.
Yes. Can you please tell me the course of external carotid artery?
So external carotid artery is one of the terminal branch from the common carotid artery, so which is divided at C4 level, and then it goes upwards
Yes.
at the behind the angle of the mandible.
Yes.
It divided into two terminal branch under the parotid gland is superficial temporal and maxillary artery.
Yes. These are the two terminal branches.
Yes.
Okay. Right. Can you tell me what are the muscles of mastication?
Okay, there are four muscles of mastication: is medial pterygoid, lateral pterygoid, masseter, and temporalis.
And these muscles are supplied by which nerves?
Is mandibular branch of trigeminal nerve.
All right. Can you tell me where would you palpate facial artery?
Inferior border of the mandible, just lateral to the masseter muscle.
Okay. Can you identify what is this number 11?
So it looks like an external jugular vein.
Can you tell me the surface marking of this structure, please?
So the external jugular vein, it is a tributaries from the subclavian vein. So on the middle 1/3 of the clavicle, it arises upwards through the posterior triangle, and
Okay.
then it has two terminal. I mean, it was formed from the retromandibular vein and other I forgot.
All right. Okay. Right. If you're looking at this 29, can you please identify that?
It's a trunk of brachial plexus.
Yes. Good. All right. Bell went. Did you hear it this time?
No.
Still not. Okay. Good. Thank you.